Hi, very good evening, everyone. Hope you're doing well. So, welcome to the next PYQ session that we have. And this PYQ session is on electron microscopy. So, well, not a lot of questions have come on electron microscopy in the previous years, to be very honest. But if you say going forward, is it an important topic? Definitely, yes. It's a very important topic. But what you don't have to be scared of is that the questions that you will get will always have a very good backup of a history. So, actually, today I've divided this session into two parts. In one part, I'm going to show you some basics of electron microscopy, and in the second part, we are going to do some MCQs that have come or could come in your paper. Is that okay? Yes. So, firstly, is the audio video all good? If yes, let me know, then we can proceed. And just give me a quick thumbs up in the chat box, and then we can start. Also, many of you were curious and wanted to know about what this quiz series that is Revisathon is all about, which is starting every Sunday at 5 o'clock. So, that obviously gives you a scholarship. Not only does it give you your ranking, and not only does it give you your assessment in the subjects, but it also gives you a scholarship. So I think it's a good deal both ways, and that is the schedule for every Sunday. So this Sunday, that is 21st of February, the two subjects that are going to be covered are going to be Ophthal and Pedia, right? So like this, you can see in front of you, every Sunday we have a particular subject on which there's going to be a test for 1 hour. There are going to be total of 45 questions. So 1 hour, 45 questions, and you can get a scholarship as well. So I think it's a good deal, and I would really encourage all of you to go for this. Okay, fine. So let us begin with today's session. Like I said, electron microscopy hai. So I think no session is complete if I don't show you what an electron microscope looks like. So basically, remember, an electron microscope always looks like this, this spaceship kind of a microscope. It doesn't look like a routine microscope. It looks like this spaceship. Everything is enclosed. Can you see? It's all enclosed because what they try to maintain inside is vacuum. What is tried to maintain inside is vacuum. Okay, so that is how you identify it. It's all enclosed, and whatever you will be putting, whatever specimen, sample, biopsy, whatever you're wanting to see, you will be able to see that on an adjacent screen. So we need to know some details, but first you need to answer 5 questions for me. Okay, should we do a first 5 question test and then I teach you everything about electron microscopy? So everyone ready for the 5 question test? Pehle, this is question number 1. Which of the following is the fixative that is used in electron microscopy? This is a very famous PYQ. Electron microscopy, what is it? Neutral buffered formalin, glutaraldehyde, BOUIN'S FIXATIVE, or 95% ethanol. Perfect. Everyone knows this. The fixative for electron microscope, good. Very good. For electron microscope, it is glutaraldehyde. Fine. So I'll be teaching you everything, but first 5 questions you need to give an answer to, then I'll teach you everything. Okay, coming to question number 2. You tell me the correct order in which the specimen is prepared for an electron microscope. These are your 4 options. You have to put them in a correct order. Tell me. Once you're done with 5 questions, I'll come back to all of these and I'll explain step by step everything. Short 5 question quiz. Tell me, guys, what is your answer over here? A and B में options में confusion है. So 1 3 4 2 and 1 2 3 4. Okay, so most of you are now in favor of 1 2 3 4. ठीक है, fine. Correct. The correct answer is 1 2 3 4, and I'll talk about it. It is fixation, dehydration, embedding, and staining. Question 3 answer karo. Heavy metals are used in which step of electron microscopy? Are they used in fixation, staining, sectioning, dehydration? Where are heavy metals used? Tell me. Fixation, staining, sectioning, dehydration. I see the answers that I'm getting. Okay. Good. So up till now, the answers that I'm getting on this are Okay, some of you have got it, some of you are a little confused. Many of you are saying sectioning and fixation. The answer to this question is staining. So these are the two answers. 3 questions done, 2 more questions left, and then I'll teach you. Question number 4, tell me what is the embedding media for electron microscope and what is the embedding media for light microscope? Give me the answer together. Electron का कौन सा है, light का कौन सा है? Embedding media. Okay, so one out of options are the same. Which one for electron, which one for light? No idea, not a problem. That is why we are here today. We are going to study it and we'll obviously have an idea after that. Still attempt. Agar guesswork karna hota, if you would have been sitting in the exam and you had to make a guesswork, what would you have done? So yes, the correct answer is for electron microscopy, the embedding media is resins, and for light microscopy is paraffin wax. So do you want to finally study what am I talking about? I am talking about, so 5 questions are done. We've got a total of some, I think 13-14 questions today, and every time first you will answer, you will judge yourself, you will assess yourself, and then we'll discuss. Chalo, let us start. First, we are talking about our primary intention of today's class is talking about electron microscopy. So, for example, let us consider someone has sent me, the clinician has sent me a kidney biopsy. Clinician has sent me a kidney biopsy, or a clinician has sent me a skin biopsy. Okay, so whatever has come to me, I need to prepare the tissue so that I can see it under an electron microscope. So how do I prepare the tissue? Please remember, the first step, this is what I told you to put in the order. The first step that I have is fix the tissue. What is the fixative that I use in electron microscopy? It's a 2 to 2.5% glutaraldehyde. That's the range. 2 to 2.5% glutaraldehyde is the fixative. Is everyone okay with question number 1? In question number 1, I had asked you what is the fixative used in electron microscope and you had to answer glutaraldehyde. Okay, this is done. Number 1 step, fixation. After fixation, you have to take out all the water from the cells. Dehydration. Dehydration, everyone knows that whenever I want to cause any dehydration, I always use alcohol. So paste solution will take out all the water. After that, I have to do embedding. I have to do embedding. Okay, Dr. Anurag, video quality, if it is a little blurred, that depends on your internet connectivity. So you'll need to check on that. The blurring of the video doesn't go from here. It depends on your connection. Just check out on that. Okay, coming to the third one, that is talking about embedding. So please remember, means what is. Now is everything okay, guys? I've changed the internet source. Let me know if all's well. If yes, we can proceed. Now it seems to be fine. Okay, perfect. Yes, it shows to be working well. Great. Okay, so back on track. I hope I'll quickly repeat this point, whatever I had told you up till now. So, sabse pehle, what had we discussed? The first step. Okay, we'll quickly talk about it. The first step that I have is fixation. How do I carry out the fixation? We carry out the fixation by a chemical known as 2 to 2.5% glutaraldehyde. Okay, coming to the next one, that is the next step after fixation, dehydration. What do you understand by dehydration? Taking out all the water, from the tissue. Let's take the example. What example did I give you? Let us say I have a patient and his kidney biopsy has come to me. So first I put the kidney biopsy in which solution? Fixation, glutaraldehyde. After that I take out all the water. So which solution will I put it in? For taking out all the water, I can use alcohol. So dehydration by alcohol. After that, I embed it. You'll ask me, ma'am, what is this embedding? Okay, so I say, for example, agar ye kidney biopsy hai, okay, if this is a kidney biopsy, you want to cut it, you want to see it under a microscope. How will you cut this kidney biopsy? You will put it in a medium. That medium is known as embedding. See, imagine this pen is a kidney biopsy and I want to put it inside some medium. That is embedding. Which medium do I use in case of electron microscope? I use resins. I use resins. You call them plastic resins also. Okay, I use resins. Fine. After embedding, now you'll say, okay, ma'am, the kidney biopsy is there in this resin. Now let's cut it. Let's section it. Let's cut through it. So the next step becomes sectioning or cutting. The next step becomes sectioning or cutting. And finally, in the end, you say, fine, I've cut through it, I've got the kidney biopsy. Now I want to look at it under the microscope. So before that, I should add some stain, or I should add some contrast. And how do I do that? I add heavy metals like uranyl acetate, lead citrate, so heavy metals. So FDESS, can you remember this? Fixation, dehydration, embedding, then cut it, that is sectioning, then stain it. How do you stain it? You'll say, for staining, I'm using heavy metals. Let us come back to our questions, guys. When our question started, do you all agree with question number 1? Which of the following is the fixative for electron microscopy? Do you all agree that there's going to be glutaraldehyde? What percentage? I've already told you, 2 to 2.5% glutaraldehyde. Now all throughout, I will keep comparing electron microscope with light microscope. So tell me, if the same options would have been there for light microscope, do you all agree the fixative for a light microscope would have been which option number? Then the fixative would have been NBF. For light microscope, it would have been NBF. NBF. That is neutral buffered formalin. Everyone knows this, previous year question again. Great. Neutral buffered formalin. Neutral buffered formalin. What percentage? 10%. So this is the fixative for a light microscope. Remember, for a light microscope, 10% neutral buffered formalin. For electron microscope, 2 to 2.5% glutaraldehyde. Let's move on to the next question. I asked you, heavy metals are used in which step? Did we just study uranyl acetate or lead citrate? Heavy metals are used in staining. Got it? So we know that. Okay. Then I told you what is the correct order for specimen preparation. So all that you had to remember was FDESS. So fixation, then dehydration, then embedding, and then you have sectioning and staining. So over here, the correct answer for me was 1, 2, 3, 4. That is clear up till now. These questions are done. What did I ask you next? I asked you, what is the embedding media for an electron microscope? Now all of you know the embedding media is resins, plastic resins that I've just taught you. And what is the embedding media for a light microscope? So I told you, for comparison, for light microscope, it's paraffin wax. I know many of you have not ever taken too much of interest in a path lab, but if you ever happen to visit a path lab, you must have seen something like this. Have you seen these wax blocks? Have you seen in a path lab, a lot of these paraffin wax blocks are there? And can you see how biopsies tissue is kept in that paraffin wax? So tell me, if you've got wax and you've got tissue inside it, ये कौन सा step है? In the wax, you are keeping a tissue. Can you call this embedding? Can you call this embedding? Embedding in a wax. Okay. And wax में embed करा है. Will you take these up for a light microscope or an electron microscope? You've embedded it in wax. Will you take it up for light or electron? Wax embedding means light microscope. It means light microscope. Are we okay with this? Do you want to see one more step? That when this embedding has been done, actually what do? Look at this very carefully. See how they are cutting. They've placed a wax block over here, and how with a blade sections are being cut. All of these are to do with light microscopy. So see, you'll place the tissue in wax, and after placing it in wax, you are going to cut it. ये कटिंग वाली मशीन को क्या कहते हैं? This entire machine, can you see the technician is moving the blade round and round? What is this cutting machine known as? So this machine is known as, see, you're rotating na, you're rotating, there's a wheel that you're rotating, तब cutting हो रहा है. So what is it? It's a rotary microtome. It's a rotary microtome. So these are some points that you have to know when it comes to a light microscope, and you have to compare it with an electron microscope. Is this okay? Dr. Nair, I'm coming to all the queries. Abhi we've hardly started. Up till now, is it clear? So you've done how the preparation is FDESS. Now you'll ask me, ma'am, this is for electron microscope. So quickly brush up some differences between a light versus an electron. Okay. So look at this. When I'm dealing with a light microscope versus an electron microscope, how many of you agree? In light microscope, the fixative is formaldehyde, and in electron microscope, it is glutaraldehyde. You know this information. What is the embedding media for a light microscope? You'll say wax. What is the embedding media for an electron microscope? You'll say resins. Fine. After that, sectioning. So did I show you this rotary microtome? तो दोनों में सी माइक्रोटोम क्या है? माइक्रोटोम इज अ मशीन दैट इज कटिंग. यू से मैम आई वांट टू कट द सेक्शन फॉर अ लाइट माइक्रोस्कोप और आई वांट टू कट द सेक्शन फॉर एन इलेक्ट्रॉन माइक्रोस्कोप. बोथ वेज आई एम गोइंग टू कॉल इट अ माइक्रोटोम ओनली. But for electron microscope, I use the word ultra microtome because I want very thin sections. I want very thin slices. So instead of calling it a microtome, I call it a ultra microtome. Okay, tell me, what was the stain that we were using for electron microscope? You know this, heavy metals. Light microscope के लिए तो we keep studying hematoxylin, eosin, GIMSA, so many stains we have. But for electron microscope, it is heavy metals. Okay, last thing guys, all of you when you go to a path lab and the examiner gives you a slide, कि ये slide देख के diagnosis बताओ. What is that slide made up of? The one that you see under a light microscope. What is that slide? It's a glass slide. It's a glass slide, है ना? And if you break that glass slide in the exam, all of us know that the examiner is going to fail us, right? So we have to be very careful with those glass slides when we are looking at it under a light microscope. Electron microscopy में the slides are made up of metals like copper. The slides are made up of metal, that is copper. Now are the differences clear between a light versus an electron microscope, starting from fixation to the embedding media to the cutting machine to the stains to finally what slide are you going to use, है ना? Is this okay with everyone? So अब थोड़ा सा आगे advanced बढ़ते हैं. Now we'll go on to our main topic, that is electron microscope, and study the two different types. Have you all read about something called TEM and SEM? TEM and SEM are two types of electron microscopes. Little bit detail, but first you have to give one test. Question number 6. You have to tell me which of the following statements about TEM is incorrect. Which of the following statements about TEM is incorrect? Then I'll teach you. First your test and then my contribution. Incorrect. Tell me. Based on scattered electrons, provides a two-dimensional image, provides details about an internal structure, allows smaller sample to be analyzed in comparison to SEM. What is incorrect? Okay. ठीक है, I'm not answering anything. I'm not giving you the answer to this question. I'll teach you everything about TEM and SEM. I'll teach you everything about these two. Then you'll reattempt because I'm getting all options from you guys. A, B, C, D sub hai. So let me teach you. So first and foremost, there's something called TEM and there's something called SEM. So EM we all know, electron microscopy. T stands for transmission electron microscopy. And S stands for scanning electron microscopy. तो खुद सोचो, transmission electron, scanning electron. Transmission, in which of them will electrons get transmitted? You will say transmitted electrons matlab TEM. And if I say in which of them are the electrons going to get scattered, you will say scanning or SEM. Have a look at these two GIFs. Don't look at both in one go. ठीक है? Have a look at this one first. Okay, have a look at this one first. Let me just remove the second one. ये वाला देखो. You can see this red color electron that is going. This red color electron that is going. And is it getting scattered from here? यहाँ से कहीं scatter हो रहा है? No. It's getting transmitted. Can you see the electron beam is getting produced and it is going on the sample? What do you want to call it? TEM or SEM? You'll say, ma'am, electrons are just getting transmitted. This must be transmission electron microscopy. And जो भी sample है, देखो, this is the sample. Whatever sample is there, when the electrons fall on it, whatever is inside the sample, internal जो भी structure है, वो मुझे दिख गया. This is TEM. Okay. Now I look at the other one. So what did I remove earlier? This one. Have a look at this one now. Compare. Look carefully. Look carefully. You have seen the electrons coming, and now this is a slow GIF. धीरे धीरे देखना this sample, how is it moving? You will realize that movement. You will see how one by one the entire surface is being scanned. Have a look at it again. It starts from this side and it goes and scans right till the end. That is like a scanning, like you scan a document in a printer or a scanner. This is scanning it. So do you see the electrons are falling and they are getting scattered? The electrons are falling on the specimen and then they are getting scattered. So when they are getting scattered, I say it is scanning electron microscope. When they are transmitted, it is transmission electron microscope. When it is scanning electron microscope. So imagine this is your specimen and bus wo scan ho raha hai. So just getting scanned. Tell me which of them is telling me the surface details. Scanning or transmission, which of them is giving me the surface details of the specimen? Now think, analyze. Surface details kaun de raha hai? The one which is scanning. So can I say the better one for getting surface details? The better one, very good. The better one for getting surface details is going to be SEM. And the one which is going to help me get internal details, is going to be TEM. Okay, in which of them am I going to utilize the scattered electrons? You'll say, ma'am, in SEM, because electrons are falling and then they are getting scattered. They are falling, then they are getting scattered. Okay, let me take a test. Let me see how much did you understand. ये वाला कौन सा लग रहा है? Focus on this and see. Electrons are falling and then going somewhere. What is this looking like? TEM or SEM? What is this looking like, guys? So you've got electrons which are falling and then they are getting scattered. Yes, they are getting, can't you see, guys? Look at the lower part of this GIF, the lower part of the image. Electrons are falling and from the surface they are getting scattered. Can you see that? Yes. So scattering reminds you of SEM. So this is most likely scanning electron microscope. Agreed? So now directly from your book, if you want to do some very, very quick differences, I think now everyone will be able to do. See, SEM क्या होता है? Scanning electron microscope. TEM क्या है? Transmission electron microscope. I know this. Very good. Which of them is based on scattered electrons and which of them is based on transmitted electrons? Very simple. Scattered is scanning and transmission is TEM. Okay, which of them is going to focus on the surface of the sample? It is going to be SEM, the scanning wala. Scanning is going to focus on the surface. Which of them is going to focus on the internal composition? That is going to be TEM. So please remember, when you're just scanning, imagine you're reading a textbook. Okay, forget this. Imagine you're reading a textbook and you're just quickly scanning through all the pages. Will you be able to cover more course like that? Or if you sit on one page and then you read that in depth line by line, in which of them will you be able to cover greater amount when you're scanning? है ना, when you're scanning, you're just flipping through pages, बहुत सारा course जल्दी खत्म हो जाएगा. So scanning allows for a large amount of sample to be analyzed because you're just superficially scanning through pages, flipping through pages. In transmission electron microscope, you're looking at internal details. अब एक line पढ़ोगे तो time ज़्यादा लगेगा. If you look at every detail of the topic, you'll take more time. So transmission electron microscope will end up making you study less amount, right? So less amount of sample will be analyzed. Lastly, TEM provides you a two-dimensional image and SEM provides you a 3-dimensional image. I think this is getting hidden. Remember, SEM provides you a 3-dimensional image and TEM provides you a 2-dimensional image. Is this okay everyone? So सब कुछ S याद रख लो. Scanning electron microscope में scanning हो रहा है. Scanning electron microscope में you have scattered electrons. Scanning is happening. Sample surface is being analyzed. Okay, and obviously if you're just scanning, then a large amount of sample can be analyzed. Let me come back to my question. Ab answer karo. Now answer please. Which of the following statement is something that you find incorrect about TEM? I think the first one only has told you. Based on scattered electrons. Is TEM based on scattered electrons? No, TEM is based on transmitted electrons. TEM is based on transmitted electrons. Now, which one do we use? Most of the hospitals are using TEM, transmission electron microscope. But again, that obviously depends on what is your a lot of factors depend on which machine will you purchase and what are your factors otherwise, but TEM is what is very commonly you must be seeing. Okay, so यहाँ तक हो गया. Should we move on now? All the basics are done, guys. You've done difference between a light and an electron microscope. You've done the types of an electron microscope. I hope you will remember these two GIFs. The one in which you are just transmitting the electrons, that is going to be transmission. The one in which there's going to be a scatter happening, that is going to be scanning electron. Now, application. What did I tell you? That today's session is divided into two parts. One is going to be studying all the basics and the second is going to be coming to questions. Basics was where if you know it, it's a fact, okay? Questions is where you can say that, electron microscope is really not going to help me. The question will help you more. I'll give you examples, okay? I'm telling you again, the hint will not be in the image, the hint will be in the question. Read. So you'll see these black and white pictures all throughout, but the question will tell you the answer. Okay, meanwhile, I'll take up some questions also. See guys, what I've told you about TEM and SEM, those are their primary functions or surface or internal structures, वो primary details हैं. That doesn't mean they don't show you anything about the internal aspect, or TEM will not show you anything about the surface. The primary mechanism is that, but ultimately you will see the entire structure because 2D ho या 3D ho, you will see the entire structure, right? Okay, so now tell me, in this question, was the hint in the image or was the hint in the question only? That is what I want to tell you. All of you are very scared of electron microscopy and you don't have to be, because if you read your question well, that you'll get your answer anyway. Okay, so you had a 34-year-old patient who's presented with diarrhea and fatigue. The stool sample is bulky and frothy. Can anyone tell me? We'll keep making points. When the stool sample is bulky and frothy, what do I think of? What do I think of? Stool sample bulky and frothy. It is correct. It is steatorrhea. When the stool sample is bulky and frothy, I think of steatorrhea. Steatorrhea means fat in the stools. There's going to be fat in the stools. Okay. After that, bulky frothy stools. Fine. Intestinal biopsy shows foamy macrophages in the lamina propria. After this line, I don't think anyone should have had any doubt. Foamy macrophages in lamina propria. Have a look at this. So see, this is the intestinal biopsy which I didn't show you. What are these finger-like projections? These finger-like projections are the villi. And can you see these empty looking cells in the lamina propria, the foamy macrophages? Okay, so what stain do these foamy macrophages pick up? Why are they foamy? Why are they foamy first and foremost? You will say, ma'am, they are foamy because they contain an organism called Tropherema whipplei. So if this word is written, foamy macrophages, lamina propria and Tropherema whipplei is there in the options, it's classically a case of Whipple's disease, no doubt on that. It's classically a case of Whipple's disease. Fine, so you say prove it. Prove that these foamy macrophages have the organism. So I say first, I do a special stain. Can you see over here? All those foamy macrophages have become pink. Anyone who can tell me why pink? What stain have I used? Very good. Many of you have answered. It is Pass positive, diastase resistant. Pass positive, diastase resistant, excellent. So ये एक hint हुआ that okay, pass positive है, maybe it is Whipple's. I say no, show me the organism. Show me the exact organism. So you say fine, let me do an electron microscopy. Let me do this black and white picture. Let me do electron microscopy. And can you see these rod-like organisms, everyone? Can you appreciate these rod-like organisms? That is Tropherema whipplei. Now it's very interesting to see this, but could you have made a diagnosis on this? No one can. No one. Even if randomly you give me this one picture of an electron microscope, if you don't tell me the history of the patient, no pathologist can make the diagnosis. So don't worry. The diagnosis is not to be made on the image for electron microscope. It has to be correlated with the history. And I think all of you are good with the history because everyone identified Whipple's disease without the image also. I'll make you practice more and then you'll realize. Coming to the next question, the most famous one that we have, the most famous one. So, 72-year-old male patient presents to the general physician with complaints of dyspnea and cough. Patient is a chronic smoker, worker in the cement industry for over 40 years. There's a pleura-based mass that is present and on biopsy shows spindle and epithelioid cells. Electron microscopy is given to you. What is your diagnosis? Dr. Amruta, I just saw that question of yours. I'll come to that. Okay, in the previous one, I'll just come. Okay, everyone give me an answer of mesothelioma. Again, I really don't think anyone saw that image. What you actually saw was okay, cement industry में patient काम कर रहा था and pleura based mass. Cement industry, pleura based mass, and you gave me the answer. Okay, so basically which exposure are you guys suspecting? Which exposure? Pleura tumor and which exposure? You said you must be expecting asbestos. You must be expecting asbestos exposure. So now the question comes, which are the two lung tumors that asbestos causes? Asbestos causes number 1, lung adenocarcinoma. Lung adenocarcinoma. Number 2, mesothelioma. Okay. Remember, lung adenocarcinoma is the most common. Carcinoma is the most common and mesothelioma is going to be the most specific. So I've given you the hint also. Carcinoma is common and mesothelioma is specific. Very good. So look at the flood of answers that have come on this. You know it. Very good. So how do I differentiate between the two? To differentiate between the two, I do electron microscopy. So what do I see on adenocarcinoma? I will say on adenocarcinoma, you will see no. Adeno matlab no. You will see no branching microvilli. So I'll show you the picture. See, this is the image that you'll get. This will be a black and white photo. You will say, ma'am, I got a picture of electron microscopy in the paper and I could see these microvilli, but they were very short. They were very short like this. There was no branching. There was no branching. ये याद रहेगा, adenocarcinoma shows you no branching microvilli. Versus mesothelioma, can you see? It shows you these very long and branching microvilli. They are branching further and further. Can you see that? So they are long and branching microvilli. Very simple to remember now. Remember, adenocarcinoma shows me no branching and mesothelioma shows me long branching microvilli. Got it? Easy. So when I gave you this question over here, yes, you had asbestos exposure. Number 1 hint was there. So you could have thought of two things. You could have thought of adenocarcinoma and you could have thought of mesothelioma. After that, you got to know pleura-based mass. Now, obviously, if the pleura is involved, which of these is the pleural tumor? Mesothelioma is the pleural tumor. Then you went on to the electron microscope. You saw that, okay, I was having long branching microvilli. Long branching microvilli were seen. Definitely a case of mesothelioma. Are we okay with this, everyone? Should we move on to the next question? Another one coming up your way? Very good. Yes, another hint of mesothelioma was there, that mesothelioma microscopically shows you two cell patterns. It can show you spindle cells and it can show you round cells. spindle cells and epithelioid cells. That was another hint that for mesothelioma was given. So ultimately, again, like I say, many questions are sorted on your history. Electron microscopy, we call it an adjunct. Okay, fine. Coming to Dr. Amruta's question, you had asked me that, ma'am, in that tropherema question, some of these were circular. See, you do understand that you are cutting the tissue. If you cut it in one plane, you were getting it as a long rod. If you cut it transversely, you will get it like a round organism. So it's just a cutting in the different planes that has resulted in this. Ultimately, both of these are tropherema vipli only. I hope you got that. आगे बढ़ते हैं. There's one more question which is from the recent question that I had put up for you. Yes, actually there are two. ये वाला बताओ पहले. Both of them are question 10, but tell me guys. 45-year-old female presents with an anterior neck swelling moving with deglutition. Electron microscopy दिया हुआ है. ज़्यादा history नहीं दिया. There is not much but adequate history given to you. 45-year-old female, anterior neck swelling moving with deglutition. When I say an anterior neck swelling which is moving with deglutition, I am definitely thinking about thyroid. They've given you 4 carcinomas: papillary, follicular, medullary, anaplastic, and they say which thyroid cancer shows you this. Most of you say medullary. Okay, I also say medullary. Why? What is this image? What are these very dark black structures that I'm seeing over here? Do you all remember, out of all these, few days back in the Kickstart morning sessions, I had taught you that medullary carcinoma of thyroid shows you neuroendocrine differentiation. Did we study this? The only thyroid cancer to show you neuroendocrine differentiation. Everyone's answering it. Very, very good. So actually, what are these dark black color granules? These are neurosecretory granules. They are neurosecretory granules. Okay, so which is now that's the trick. Remember this photo as it is, because if I put this photo say in a neuroblastoma, you'll say okay, neurosecretory granules. If I put this photo in a carcinoid tumor, you'll say neuroendocrine tumor hai, to neurosecretory granules. If I put it in thyroid, medullary carcinoma, you'll say neurosecretory granules. Any neuroendocrine tumor of the body will show me neurosecretory granules. Now tell me, which lung cancer will show me these neurosecretory granules? Which lung cancer? Adeno, squamous, small or large? Which lung cancer? So obviously the neuroendocrine differentiation wala lung cancer is small cell lung cancer. Excellent. It is small cell lung cancer, right? So now copy paste this picture everywhere for any neuroendocrine tumor, like I showed you over here, medullary carcinoma. So this was not giving you too much of a hint, right? I just gave you thyroid tumor hai and guess karo. Actually, how the examiner will give you is something like this. It's the same question. I have given you a proper question now. See, now I'm saying you have a 45-year-old female who has presented with an anterior neck swelling which is moving with deglutition. So same history, thyroid hai. On FNAC, the smears are cellular and diagnosis of a thyroid tumor are made. Okay, excision is performed and you can see extracellular material which is pinkish. Anyone who can tell me what am I talking about? Extracellular material which is pink. One hint. Presence of plasmacytoid cells, hint number 2. And neurosecretory granules, hint number 3. Perfect. Guys, the extracellular, क्योंकि amyloid हमेशा extracellular होता है, that's the definition of amyloid. Amyloid is always extracellular. So number 1 hint that you got over here was amyloid. What are the kind of cells that you see in a patient of medullary carcinoma? I taught you a few days back on Kickstart, plasmacytoid cells. And what differentiation do you see? Neuroendocrine differentiation. Again, everything is pointing towards medullary carcinoma. So tell me the mutation also na. Now finish it off. Tell me, so that I'm also very happy that okay, everyone is up and awake in the morning sessions. Medullary thyroid cancer ka mutation bata do. Or do you think it's a mutation or a translocation or a fusion, whatever you think? Okay, so everyone remembers ret kya? Ret ka, should I say gain of function, loss of function? Okay, ret med men. Everyone remembers the mnemonic? Good. Ret ka point mutation. Which kind of point mutation? Gain of function, loss of function? Gain of function. Do you remember this? Gain of function. Okay. Excellent, डॉक्टर ऋत्विक. आई वाज जस्ट आस्किंग दैट एक मैंने एक्स्ट्रा एज क्वेश्चन बताया था कि जो म्यूटेशन होता है वो कौन से एक्सॉन पे होता है. ऑन विच एक्सॉन डू यू सी दैट म्यूटेशन? सो टेल मी. Excellent, very good. Dr. Shubhrasmita remembers, everyone remembers now. Exon 6. Exon 6. So, see, something I told you to, that you can even forget if you want, but still you remember it. That is amazing. So, please remember for the others, we had done a very, very simple mnemonic, and that mnemonic went as ret med men. Okay, so ret 10 med men. That was, do you remember this, everyone? Ret 10 med and men. So if you remember, ret was the name of the gene. It is present on chromosome number 10. The thyroid tumor which it causes is medullary thyroid cancer. Medullary thyroid cancer, and the syndrome with which it is associated is Men syndrome. To be very precise, Men 2A, Men 2B. So remember, ret 10 med men, something that you have to learn. Okay, आगे बढ़ते हैं. So having done this question, one more question which is my favorite, because the way I framed the question, I feel examiner is just wasting your time. So you've got a 19-year-old female patient with fever, fatigue and bleeding gums. Hemoglobin is 9, TLC 56,000, platelet 80,000. Peripheral smear examination shows you blasts which are positive for MPO. Electron microscopic image is shown to you. What is the diagnosis? ALL, AML-M2, AML-M6 or AML-M7? Very good. तो इसमें did you need this picture? Tell me honestly, did you need this picture? I really don't think so. This picture was not needed. I have told you, first and foremost, you have a 19-year-old female, fatigue, fever, bleeding gums. TLC 56,000. Normal TLC is only 4,000 to 11,000. TLC is elevated. And peripheral smear is showing you blasts. What kind of blasts? You will say blasts are positive for MPO. If they are positive for MPO, means these are myeloblasts. Very good. They are myeloblasts. So clearly I am dealing with AML. I am dealing with AML. Fine. If I have myeloblasts, what do I expect? How will I differentiate a myeloblast from a lymphoblast? What is that thing that you see? Characteristically that you see in a myeloblast only and you don't see in a lymphoblast. All of you know it. You see all rods, hai na? In a myeloblast, don't we see lots and lots of OR rods? That photo I didn't give you. But I told you that MPO positive hai. Indirectly I told you MPO positivity, so I told you myeloblast. But can you all see these rods like this cell and this cell? Can you all see these numerous OR rods? Yes. So this further proves that I'm dealing with myeloblast. इन्हीं rods को black and white करके देखो. इन्हीं rods को black and white करके देखो. So I've just put it up in an electron microscope. These are the same OR rods which I gave you in your paper, which I gave you in your question. You can see these OR rods. This was just to confuse you, because when you see such an image in the exam, what is the first impact that you get? I've not read this question. I've never seen this picture. This is something new. This is something I'm going to leave. But that is the mental block I want you to get over with it now. If you have an electron microscopic picture, don't be scared. Jump to the history first. Take support from the history. 99% cases you will be able to solve. So clearly, MPO positive है, myloblast है, ALL तो नहीं हो सकता. Myloblast है, so AML, M2, M6, M7, AML है. Myeloblasts are obviously seen in AML, M2. M6 and M7, if you remember, what's the other name of M6, guys? What kind of blasts do you see in M6? What kind of blasts do you see in M6? M6 में हमें erythroid blasts दिखते हैं. Erythroblasts are seen in M6. And in M7, we see the megakaryoblast. we see the megakaryoblast. So we don't see myeloblasts. In M6 we see नहीं Dr. Anisha, monoblast M4 M5 का feature है. Mono series is M4 M5. M6 is red blood cells, M7 is megakaryoblast. ठीक है? For the others also who answered mono guys, remember it is going to be M4 M5. So इसमें clear था. एरिथ्रोब्लास्ट में और रॉड्स नहीं दिखेंगी, दैट आई एम सीन ओवर हियर. मेगाकैरियोब्लास्ट में और रॉड्स नहीं दिखेंगी. इन AML M2 I will see और रॉड्स, so that was the answer. No, Dr. Akshay, this is not a 1 hour session. This was a 45-minute session only. But one last question is left, okay, and after that we'll finish. एक question 12 और है, which is a spotter, and really I don't have to teach you much in that. 5-year-old child with lytic bony lesions and skin lesions. Now batao. The biopsy shows something which I have shown you. Diagnosis. It's a spotter. Trust me, I think you can teach me better. I have nothing to teach you in this. 5-year-old child, lytic bony lesion. In the exam, many students, the first impression that they have on seeing lytic bony lesions is multiple myeloma. Examiner will do this. Lytic bony lesions के साथ हमेशा पहला option multiple myeloma होगा. Don't fall for that trap. Read everything. Look at the age of the patient. Look at the picture given to you. Yes. What is the picture given to us? Okay, so if you look very carefully, there is a tiny tennis racket that I'm seeing over here. There's a tiny tennis racket. That is the picture that I'm seeing. So this is a case of Langerhans cell histiocytosis. Perfect. So I'll show you a better picture. This came in your previous year papers, but it's not a very good picture. A very classical picture is this one. But either ways, जो previous photo है, that came in your paper, so you should be able to pick up this tennis racket that they put up over here. Acha, so now this is the image that you need to know. The black and white photo, electron microscopy, Langerhans cell histiocytosis, tennis racket. So what exactly is tennis racket? The Burbeck granules. ये जो Langerhans cell है, the Langerhans cell that has granules. What are those granules known as? Burbeck granules, and those granules are giving me this tennis racket appearance. Langerhans cell as a whole doesn't give me tennis racket appearance. The granules, Burbeck granules, give me the appearance. Are we okay with this? So coming back, it was not multiple myeloma, it was not leukemic infiltrate of bone marrow. Someone asked me what is HCL, hairy cell leukemia. It is not a case of hairy cell leukemia. It is definitely a case of LCH, a classical one. Okay, so electron microscopy is never ending. Why? Because I can give you any random scenarios. So now tomorrow morning when we meet at 7:45, tomorrow morning, I hope you remember, tomorrow morning the kickstart session is a mixed bag. Okay, so instead of asking you some random questions, I'll ask you questions pertinent to topics that I have taught you in this 1 week over YouTube and the kickstart morning. So I'll ask you, say, 2 questions on something about an electron microscope, not the ones that I've taught you today, some new questions. Okay, and after that, I'll ask you one question about a thyroid tumor, one question about maybe the virus, one question about fungus. Whatever I've taught you in this week, I'll twist and turn and I'll ask you questions from that. Okay, so be prepared. Tomorrow morning 7:45 is our mixed bag session on the Unacademy app. Yes guys, Dr. Nair, I'll take care of that and I'll let you know for the PYQ sessions, not this week. This week we already have it on YouTube, but following March, I'll continue that on Unacademy. ठीक है, as you say. Yes, Dr. Muskan, I will be giving you an update on that by Monday. Okay, Dr. Shubhrasmita, we have already discussed brain tumors long back in one session on the Unacademy app. If you want, I'll repeat it with the recent advances. Okay, what else? Thank you so much, guys. Thank you. And like I always say, no matter good, bad, how the class is, you guys are always very appreciative. And that gives me a lot of, it teaches me to be appreciative towards others. And it also gives me a lot of motivation. Thank you so much. Thank you. And Fine. Thank you guys. Don't worry, all these sessions that you're writing down, CD markers, parasitology, ये सब list में है. And we have another Kickstart morning sessions are not going anywhere. So I'm making a list and I'm noting down all the topics and everything I'll try my level best to cover, right? Thank you so